So today we will discuss about the respiratory system, which is very important for the NEET point of view. Respiratory system anatomy. So in case of human respiratory system, the respiratory system consists of nose, pharynx, throat, larynx, which is voice box, trachea, windpipe, bronchi, and lungs. Today we will discuss about trachea in detail. So here you can see the diagram of trachea. You can see there are 23 generations starting from 0 to 23, which is called Weibel generations. Direct question, 23 generations, Weibel generation. So this Weibel generation, between trachea and alveoli, airway divides into 23 times. This 23 generation means between trachea and alveoli, the airway divides 23 times. Right? So there is a division 23 times, there is a division of airway. So trachea starts, then it bifurcates. It bifurcates at the angle of Lewis, again direct question, or you can say sternal angle or second intercostal space. Remember all these points. These all points are very, very, very important. That trachea divides at the angle of Lewis or sternal angle or second intercostal space. Right? Now, the trachea divides into right and left side. Right? So, the right side is straight, short, and wide. Why it is important in case of dentistry? Right side is straight, short, and wide. The importance in dentistry is sometimes when, especially in case of endodontics or in small object like you are placing the post inside and patient got it inside her or his mouth, then it will get stuck into the right side of the trachea. So for the chances of foreign body stuck is towards right side, right? So there are two divisions, 0 to 16, it is called conducting zone, and from 17 to 23, it is called transitional and respiratory zone. So why it is called conducting and transitional zone? At the 16th level, there is a terminal bronchiole. At the 16th level, there is a terminal bronchiole. After that, there is a transitional or respiratory zone left with the 7 divisions. Right? So remember this, very, very important. Right? Now, in case of conducting zone, let us discuss about the conducting zone. The first division now in case of conducting zone, now let us discuss about the conducting zone. It consists of series of interconnecting cavities and tubes both within and outside the lungs. Right? So the important thing you have to remember here, the trachea and the bronchi has less of smooth muscles and more of cartilage, right? Whereas in case of terminal bronchi, the smooth muscles are high, present most of the smooth muscles. That means cartilage is almost no, right? Just remember. Now you'll get direct question that terminal bronchiole, most of the smooth muscles are present in the terminal bronchioles, right? Now, it is lined by, there is a lining present which is ciliated pseudo. Now the respiratory mucosa, respiratory mucosa is lined by ciliated pseudo stratified columnar epithelium, which secretes mucosa. And what is the function of cilia over here? Cilia moves mucus up towards the mouth. If cilia are absent, if cilia is absent, then there is difficulty in what? There is difficulty in the movement of the mucus. So in case of these cilias have microtubular protein, which is, just remember, dynein, right? There is one situation which is called Cartagena syndrome. Here, dynein is absent, so there is no movement of sputum, right? So in case of absence of dynein, there is no movement of sputum, there is no motility of sperm, and you can see, due to less movement of mucus, there is airway obstruction, right? So in case of no movement of sputum, what will happen? If sputum will not move, there is stasis of sputum. And due to stasis of sputum, there is repeated infection or inflammation. So this will cause bronchiectasis, which is bronchi dilation, right? Because cilia helps in movement of secretion from lower respiratory airway to oro and nasopharynx, right? Basically, dynein works as a motor, which pull mucus from lower respiratory tract to upper respiratory tract. Right? Movement of mucus to pharynx. Now there is one condition which is called cystic fibrosis. What happens in cystic fibrosis? I'm directly discussing questions with you because there are a lot of things we have to learn. So let's learn and remember important points only. There is CFTR gene in chromosome 7. So in this case, there is transmembrane regulation. That means defect in chloride ion channel. Defect in chloride ion channel. So due to this, there is mucus which is formed is very, very thick. So this is due to this thick mucus formation, there is mucus stasis. So here the defect in CFTR gene in chromosome number 7. So due to this, there is defect in chloride ion channel, right? So cystic fibrosis is due to thick mucus formation, right? Now come to cells of connectivity. Now come to cells of connectivity. So conducting, sorry. Now come to cells of conducting. Now what are the cells of conducting? First is basal cells and second is Clara cells. So these basal cells are called stem cells. These are basal cells and second cells are Clara cells. They Clara cells. They helps in detoxification of stem cells. That means they are not stem cells. Clara cells are not stem cells, but they don't have any role in, and they the Clara cells are not stem cells and they do not have any role in surfactant production, right? But they helps in detoxification of stem cells. So these are also important, Clara cells. So now what happened in conducting system? See, there are smooth muscles. Right? In exaggerated bronchoconstriction, these cells become enlarged. And there is bronchoconstriction. So exaggerated bronchoconstriction, for example, in case of bronchial asthma, so we need bronchodilators because it increases the air resistance to airflow, right? So this is a reversible condition. In this case, we'll prescribe bronchodilators. For example, salbutamol. They allow this cell to remain in their normal condition. So this condition is reversible, right? Now, what are bronchodilators and what are bronchoconstrictors? So bronchodilators are, just remember this chart. So bronchoconstrictors are parasympathetic activity, acetylcholine, methacholine, histamine, leukotrienes. So most potent is leukotriene B4, leukotriene C3. And bronchodilators are work on sympathetic system, beta-2 agonist like salbutamol, right? Now come to respiratory zone. Respiratory zone consists of tubes and tissues within the lungs where gas exchange occur. So gaseous exchange occurs in respiratory zone. The respiratory zone, bronchioles, alveolar duct, alveolar sac, alveoli, where there is gas exchange occurs. So gaseous exchange occurs in the cells called pneumocytes. These are type 1, type 2, right? Type 1 lines the alveoli, and type 2 works as surfactants. That means dipalmitoyl phosphatidyl aniline or lecithin. Just remember this. Type 2 works as surfactant. Very important. Very, very, very important. Right? So, in case of pulmonary fibrosis, type 1 cells are destroyed and type 2 cells act as stem cells. Right? Pulmonary volumes and stains. You will get direct questions from pulmonary volume and pulmonary capacities. Just remember this chart. When you are inhaling inside, exhaling outside, inhaling inside, exhaling outside. This is called tidal volume, which is 500 ml. And when you are doing exercise, then you are inhaling more and also exhaling more. So this portion is called inspiratory reserve volume, which is 2 to 3 liters, mainly 2 liters if you'll get question. And which you are exhaling is expiratory reserve volume, which is 1.3 liters, right? Even after expiratory reserve volume, there is residual of gas inside, which is called a reserve volume, which is around 1.2 liters, right? Which is around 1.2 liters. Now, what is inspirational capacity? Inspirational capacity is tidal volume plus inspiratory reserve volume. And what is functional residual capacity? FRC. It is expiratory reserve volume plus residual volume, which is around 1.3 to 1. Which is around 2.5 liters. 2.5 5 liters. So total lung capacity is tidal volume plus inspiratory reserve volume plus reserve volume plus expiratory reserve volume, which is around 5 liters. So your functional residual capacity is 50% of total lung capacity. Just remember this, 50% of total lung capacity, because this is 5 liters, this is 2.5 liters. Now, what is vital capacity? Vital capacity is total lung capacity plus residual volume, which is, total lung capacity minus vital capacity is total lung capacity minus residual volume, which is 3.8 liters, because this is 5 liters minus 1.2 liters, right? So just remember this, functional residual capacity is 50% of total lung capacity and residual volume is 20% of total lung capacity. Residual volume is 20% of total lung capacity. That means residual volume divided by total lung capacity is equal to 20%. So if it is residual volume is more than 20%, then that means there is air trapping, which is in case of obstructive lung disease. That means the residual volume over total lung capacity is equal to 20%. And if residual volume is more than 20%, that means air trapping is there, which is in case of obstructive lung disease, right? Now, forced force vital capacity. What is force vital capacity? It is deep inspiration followed by fast and forceful expiration. It is time dependent. It is for 6 seconds. However, forced expiratory volume 1s is forced expiration volume for first second. And remember, in the first second, when we are expirating the air, then in the first second, 80% of air will get out. You have to remember this, right? So in case of forced expiratory volume 1 divided by force 1 second, forced expiratory, forced vital capacity is equal to 80%. So this, if this decreases, then there is decrease in obstructive lung disease, which is called decrease in obstructive lung disease, which is called Tiffin's index.